Whether you can directly define it or not, most of you watching this probably know what a placebo or the placebo effect is. The direct definition of which is a usually pharmacological inert preparation prescribed more for the mental relief of the patient than for its actual effect on a disorder. The most common and well-known placebo used in medicine is the sugar pill. The placebo effect, which is trying to be achieved by using such methods, is defined as a beneficial effect produced by a placebo drug or treatment, which cannot be attributed to the properties of the placebo itself and must therefore be due to the patient's belief in that treatment, a powerful tool that your body can implement by simply believing in something. And even that isn't entirely true. In one study by Dr. Ted Kapchuk on people with irritable bowel syndrome, it describes half of the study volunteers were told they were getting an open-label placebo, and the others got nothing at all. He found that there was a dramatic and significant improvement in the placebo group's IBS symptoms, even though they were explicitly told they were getting a sugar pill without any active medication. Many such cases like this exist, and I won't bother getting into all of them, but one that I will touch on real quick is a study done on hotel maids, where they were divided into two groups, where one group was told that what they were doing, as far as their job is concerned, meets the Surgeon General's definition of an active lifestyle, while the other group was told nothing. And despite the fact that nothing about their actual work changed, other than knowing what they were doing counted as an active lifestyle, it describes that 1 month later when they went back, in the group that had been educated, there was a decrease in their systolic blood pressure, weight, and waist-to-hip ratio, and a 10% drop in blood pressure. This is all well and good, but why did I ramble on for 2 minutes about placebos? People can take sugar pills and cure their headaches, or be told certain things in studies and all of a sudden they're losing more weight than they otherwise would have. This all seems like a net positive, so why did I describe in the video title the most horrifying thing that the body can do? Well, what if placebos could work in the opposite direction? You take an inert drug with some made-up side effects, and all of a sudden you're feeling those side effects: headaches, nausea, vomiting, depression, all symptoms developed from a medication or a drug that could never give you those symptoms to begin with. But why stop at just those symptoms? What if placebo could alter your physical body, increase your heart rate, increase your blood pressure, change the shape of your heart, or even cause your death? Let's take a step back from this for a second. Nocebo, a term defined as a detrimental effect on health produced by psychological or psychosomatic factors such as negative expectations of treatment or prognosis. In 1967, a woman was admitted to Baltimore City Hospital, complaining about shortness of breath, chest pain, nausea, and dizziness. She was 22 years old and hadn't had any health problems until just over a month earlier, and on the day before her 23rd birthday, she would be dead. Her death made no sense as she was perfectly healthy up until about a month ago, but as is described by Frank Burrs in the article Inside Psychogenic Death, the phenomena of thinking yourself to death, there seems to be more to this story. As he writes in his article, after 2 weeks she finally confided to the doctor what she believed was wrong with her. By then, she only had a few days to solve it. As it happened, the woman had been born on Friday the 13th in Florida's Okefenokee Swamp. The midwife who delivered her had also delivered 2 other children that day. She told the girl's parents that all 3 had been hexed. The first girl would die before her 16th birthday. The second would die before her 21st. The third, the woman in this hospital, would die before she turned 23. As it happened, the first girl was killed in a car accident on the day before her 16th birthday. The second made it to her 21st birthday. She thought the spell was broken, so she went out to celebrate, but at the bar, a fight broke out, a gun went off, and she was also killed. This left the third woman convinced beyond all doubt that she would die as the woman had foretold. Then on the day before her 23rd birthday, she did. The term for this phenomena is Voodoo Death, and it was coined in 1942 by Walter B. Cannon. It is also known as Hex Death, or as we've already stated, Psychogenic Death. In Cannon's early explanations of this phenomena, he would say that the emotion of fear working on the mind causes a fall in blood pressure as brought on by a reduction of the volume of circulating blood. He would elaborate on this by saying that the constant injection of adrenaline into small arterioles which constrict prevent a proper flow of blood within the body and causes a drop in blood pressure. From there, the weak blood pressure prevents the sufficient circulation of the blood by damaging the heart and nerves responsible for the maintenance of the vessels which transport blood, thus making it harder for circulation to continue since the very organs necessary to maintain proper blood circulation are deteriorating. A man arrived at the emergency department of his local hospital. He's said to have been muttering, "Please, please help, I swallowed all of my pills." He had dropped an unlabeled medicine box on the floor of the hospital, and the staff immediately started the required emergency procedures. The 26-year-old male was very pale, apathetic, and could barely communicate. He managed to explain to the emergency room staff that he was a clinical trial patient, and he had taken 29 remaining tablets of an unknown experimental therapeutic. This therapeutic was meant to treat depression, but his own impulses to commit suicide led him to take the remaining 29 tablets. After doing this, he realized he wasn't ready to die and had his neighbor take him to the nearest hospital. Upon examination, it was revealed that he had severe hypertension. His blood pressure was 80/40 and dropping. His heart rate was elevated to 110 beats per minute, and he was shivering and breathing rapidly. To prevent his blood pressure from falling even more, he was given an intravenous infusion of 0.9% solution of sodium chloride. Over the next 4 hours, he would receive 6 liters of this fluid, which would only serve to partially stabilize his blood pressure. During these attempts to stabilize him, the staff would learn more about his experimental trial and find out that he was in the placebo group. And in less than 15 minutes after being informed he was a part of the placebo group, his heart rate and blood pressure would return to normal and he recovered from being lethargic. This account would be written about by Dr. Witkowski and colleagues in the article titled "Mr. Hyde, The Dark Side of Placebo Effect," and anecdotally this story would seemingly make a lot of sense. In the article, fear of dying during a heart attack is linked to increased inflammation by the European Society of Cardiology. They're quoted as saying, "Secondly, fear of dying is not just an emotional response, but is linked into the biological changes that go on during acute cardiac events. Large inflammatory responses are known to be damaging to the heart and to increase the risk of long-term cardiac problems such as having another heart attack. We found that when compared with a low fear of dying, intense fear was associated with a 4-fold increased risk of showing large inflammatory responses, measured by raised levels of TNF-alpha. Interestingly, this was independent of demographic and clinical factors such as the severity of the cardiac event. And outside of just death and near-death symptoms, you have stuff like Takotsubo syndrome, which is what I alluded to earlier when I said the restructuring of the heart. This symptom, however, is reversible, and in the article, A Broken Heart Clinically Speaking, the story of Takotsubo syndrome, they state, despite being a form of heart failure, Takotsubo syndrome is not currently a Center for Medical and Medicaid Service covered indication for cardiac rehabilitation. Some patients qualify initially because they are treated as having a heart attack or heart failure with low ejection fraction, but by the time they are referred, their heart function often has recovered and they no longer meet the eligibility criteria. And the list of effects from nocebo seemingly just go on and on. Things like pain, nausea, muscle aches, depression, anxiety, sleep problems, loss of appetite, sexual dysfunction, all of these things a result of your brain thinking the worst. At least that's what's to be suggested from all this. The idea that a nocebo can cause death, or your brain can cause its own death, psychogenic death, however you want to describe it, it's still pretty heavily debated. Not so much whether or not these symptoms are real, because they are real, obviously, they happen, but as to what would cause somebody to die, what causes people to react this way, all of that sort of thing. In opposition to Dr. Cannon's previously expressed beliefs on how this works, Kurt Richard found during a lab rat study that the heart rate slowed down prior to death and the heart was engaged with blood reflecting a state of diastole. This contradicted Cannon's proposal that sympathetic adrenal overactivation is the result of death, since a sympathetic overarousal would increase both heart rate and blood pressure to a severe degree. Richard interpreted this as rats died as a result of overstimulation of the parasympathetic nervous system, specifically the vagus nerve, which regulates heartbeat. The lethal vagal effect was a psychological state of hopelessness. In 1974, Dr. Clifton Meter, a Nashville physician, treated patient Sam Lond for cancer of the esophagus. Lond died a few weeks later, but an autopsy revealed that his esophagus was fine. He had a few cancerous spots on his liver and one on his lung, but not enough to kill him. 3 decades later, Meter told the Discovery Health Channel he died with cancer, but not from cancer. I thought he had cancer. He thought he had cancer. Everyone around him thought he had cancer. Did I remove hope in some way? Even without fully understanding it, it remains that the body's reaction to nocebos is one of the more terrifying things, if not the most terrifying thing that the body can do to itself. And with that said, I'm going to end this video here. If you would like to read any of the articles that I used for my information, the full citations will be in the description. And before I say goodbye, I'd just like to say that I hope you're all doing well, both mentally and physically. I know videos like this aren't exactly the most happy or upbeat videos that could be made, so I'd just like to extend an open invitation to my comment section, not to get you all to just like and comment and whatever, but if you need to talk about something or you want to talk about something, comment there. I typically respond to all of them if you need somebody to talk to, and obviously for any of you who know me personally, you can just shoot me a message. And with all of that said, I love you all, and I hope you have a nice night and sweet dreams.